Good morning, Nurse.org Instagram. I am Marissa Dennis. I am a nurse practitioner in Kelowna, BC, and I work in aesthetics. So I am here today to take you along on my journey of my regular day-to-day. So I'll just give you a little bit of background about myself. I have been in nursing since 2007. I have previously worked in addictions, intensive care, emergency, and med-surg. I started my career in Edmonton, Alberta. I moved out to Vancouver for a while. I did some travel nursing down in California, and then I settled here in Kelowna, BC about 9 years ago when I started in aesthetics as an RN. And then I finished my NP in 2020, and now I have just opened my own clinic in January. And then I also work as an instructor, and I do some teaching as well. So follow along with me, and I do have a few questions that you guys want me to answer, so make sure to check it out. And if you want to follow me on my page, I'm going to link it right here, and you can follow me. So I had someone ask, what procedures can I do under my scope and how did we learn them? So I'm going to answer this in two parts. So number one, what procedures can you do? I did try to link the sticker text, but I'm having some technical difficulties, so I could not. But essentially, check with your college. So it's really going to vary depending on where you're practicing and depending on what your designation is. So it's going to vary from RN to NP to practical nurse. It's going to vary from California to Florida to here in Canada. So here in British Columbia, as a nurse practitioner, I can diagnose, assess, and treat independently. And I can also delegate to RNs. So I myself can perform neuromodulators, fillers, threads, as long as they're all Health Canada approved. And then I can also have nurses working with me who can also do neuromodulators, fillers, and threads with my direction and my supervision. Here in BC, the medical director or the delegating NP has to be in the building for an RN or an LPN, a licensed practical nurse, to perform those procedures. Okay, so I got a question about the safest, healthiest lip filler. Essentially, anything that is FDA or Health Canada approved will be safe. Some are indicated in lips, some are used in the lips off-label. So essentially, we know that the filler is safe. It might be safe to use somewhere else on the face, so we can often assume that it is safe to use in the lips. But what it really boils down to is picking the right injector. So making sure you are seeing someone who is actually a medical professional and who is allowed to be doing the fillers in your lips. And then there are all sorts of brands on the market. Again, they're all safe. I like hyaluronic acid filler in the lips because it is reversible, so I think that is absolutely the safest thing to do. And then you're going to pick your brand and your specific filler based on kind of where you're starting, what your goals are, potentially your injector preferences, but usually for lip filler, we're doing kind of a soft to a medium filler as they are different consistencies. Okay, so I'm just going to take you into my clinic here. So here's the outside. And here is the inside. Got all the skincare here. There's Krista. Hi, Krista. This is my treatment room that I usually work out of. Still have to hang up a couple pictures. I'm all set up for my next patient who is a lip filler patient. I got some anatomy books up here, supplies in there, sink in the corner, and my desk and consult area here. And then we do have a second treatment room. I have some art coming on the walls. This one's still getting set up. We have a couple of facial machines. This one just came in, so we're gonna get that set up. So another treatment chair, another area for a nurse to work and a medical esthetician. And then last but not least, that's just the bathroom over here. You guys can have a look at it if you like. But then we also have the storage area where we keep all of our equipment. We have a little area here, and I am just in between patients right now, so I am just mixing up a little more neuromodulator for my afternoon. This morning I saw two new consults, one we did lip filler on as well. I saw a repeat maintenance tox patient, and I saw another new consult with a tox appointment. So typically during my consults, I do take a while with them. I like to spend about an hour with my patients, and we go through their current skincare practices, kind of what their goals are over the long term. We talk about mechanism of action and what injectables can do, what skincare can do, and what the options are for them. And then if they decide to move forward, we can sometimes do a little bit of treatment same day. We can do some tox treatment same day, or maybe like one small area of filler, kind of depending on the appointment length. However, if they're wanting a little bit more than that, if they're wanting like a full face filler, we usually rebook that for another day. And then what we do is we talk about their budget and what's going to be realistic in terms got cut off there. So we talk about what's going to be realistic in terms of their budget and the way that they're able to maintain. So depending on their goals, I'll make my recommendations for injectables. If they need to get skincare recommendations, we'll do that as well. And then we'll talk about if they need surgery. So sometimes they're surgical candidates. They might not be appropriate for injectable treatments, or they might be best off getting like a laser treatment, in which case I will refer them out. We also touch on during the consult their diet, exercise, lifestyle habits, things like that, whether or not they're smokers, alcohol and things like that. And we talk about that because that will also affect the way that they age and potentially the way that their treatments turn out and their healing time, etc. So that's basically how we do our consults here at the clinic that I'm at. And yeah, that's it. I'm going to pop back on here in a little while, and I'm going to put up another question box for you guys because you have a lot of really good questions coming, and I'm going to answer a few more. So my patient's just running a couple minutes behind. So one of the questions you guys had asked is if I have any books or resources that I would recommend if you're looking to get into aesthetic nursing. And yes, I do. Nurse.org actually has a really great resource about aesthetic NPs. So I'm going to link that here. And then I'm going to post another story with a link to my webpage where I put up a blog every month. So if you're already an aesthetic NP, there's some great stuff on there on ethics and just neuromodulators and fillers and complications and all sorts of different things. And if you're looking to get into aesthetics, if you go back to the very first blog post, there is one about getting into medical aesthetics or aesthetic nursing. And if you guys want anything else, recommended reading resources, I'm happy to send you that. I do have a list I can send out to you. So if you want to DM me, not here on the Nurse.org, but to my np.marissa.aesthetics, then send me your email address and I can send you a resource list. So I just have another second between patients. Again, right now I am just making myself a coffee here in my little storage area / staff area. So I'm just going to post the Maya website here as well. So if you guys want to check that out, like I said, there is an article right at the end, the very first one posted, the first blog post that goes over how to get into aesthetic nursing. So I just had another second between patients here. So I just saw a patient for a full consultation. So we built out a treatment plan for her, which included some upper face fillers, some lower face biostimulant with filler, some skincare, some tox, and some facial treatments, as well as a referral out for laser. So I'm just putting that all together now, and I have software that I send that out to them on so that they have a copy of their recommended treatment plan and the order that we're doing everything, as well as the associated investment costs. So that is what I was working on. And then I had another patient who popped in and we just did a little lip touch up and her full face tox. And I'm just waiting for my next patient who is a tox follow-up. So all of my patients, after I see them for the first time, I always do a follow-up with tox. I do it in 2 weeks just to check to make sure everything is good. And then with filler, I typically do it a month later. So I have that coming up, but I did want to pop on here and answer another one of your questions while I had a couple of seconds. So someone had asked what the best concentration in NP school to end up in aesthetics would be. So here in Canada, there aren't a lot of options. Essentially, you can do your adult stream, you can do your pediatric stream, or you can do your family stream. I did adults because I knew that this is what I wanted to do, and I am not treating pediatrics in aesthetics, obviously, so that worked well for me. However, if this is something that you're looking at doing, I would say either dermatology, because I know in the US you guys have a lot more specialties, so I would say dermatology would be a really good one because there's a lot of stuff that we do that has to do with the skin and in the specialty in the skin. And then another good option could potentially be women's health. It would depend if you wanted to be full-time aesthetics or if you wanted to do a combination, because you would have, that could go across your patient population. You might have a lot of the same patients for your women's health, for like HRT or something, that you also might have for aesthetics. So that would be a good crossover area that you could take. So I just finished up in clinic for the day. So I am just getting my room cleaned up. I'm going to set up for my first patient tomorrow, which is a full face filler patient. So I'll just get everything set up for them here. I have to finish up a little bit of documentation. So finish up my charting. I do it all online on an EMR online. And then I will be sending out my treatment recommendations for the couple of new patients that I saw today. And I also have to do some admin stuff, so catch up on emails. I've been trying to do that in between patients today, but there's a bunch of stuff happening in the background. So I do have to do catch up on some insurance stuff, as well as, I don't even know, I haven't even looked at them, but I am going to pop back on here in about 20 minutes, half an hour, to answer a few more of the questions you guys had, because there were some really good ones. So I'm going to put a box here as well, so if you have any questions, put them in here and I will answer them this evening. Okay, I am back. So I just wanted to make sure that I answered all of the questions that I got today before it was time to log off the IG takeover. So I had a couple more. So one of them was, do I train nurses and NPs from the US, and what would be the process? So right now I only offer training in Canada. I do have an online foundational neuromodulator course that will be launching soon. I will link it here. You guys can have a look at it if you're interested at all. And then the in-person part of it, because this would just be the theory portion, which covers technique, dosing, medication administration, and all that stuff. The in-person part would be in Canada. So you would have to come to Canada. You would not be able to inject unless you were licensed here. So that would be the only drawback. So you could come and you could shadow and do mentorship days. If you're interested in advanced techniques, that's actually a really great way to go, is to come and shadow. So that is one option. So you can definitely book that and look more there, or you can send me a DM. I also wanted to give you guys a little bit more behind the scenes action. So I just got home about an hour and a half ago from the clinic. I stopped at the grocery store on the way, picked up some food because the girls got to eat. And then I came home and I had a Zoom call with a colleague of mine. She is setting up her own practice. So we just went over some protocols and procedures and things she might want to know business-wise. I just gave her a little bit of advice. And then I have been catching up on some emails through work. I've been working on some back end stuff for the course that will be launching soon. So just making sure that the videos are working properly and that all the PDFs are uploaded appropriately, etc. And then I also have been catching up on some emails. So I sit on the board of the Canadian Society of Aesthetic Specialty Nurses, and we are organizing a conference here in Canada in October. So we're organizing a cadaver lab, and I'm just trying to get some of that worked out right now on the back end. So that is what I have been doing so far this evening. So I will be honest, you guys, I don't know if this is a typical life of every aesthetic NP injector, because I do have quite a lot of things going on. But when you do own your own practice, when you own your own clinic, there's obviously the daytime of injecting, and then there is the back end of things where you have to do a lot of administrative tasks. You have to review profit and loss statements. You have to be a business owner. You have to think about hiring and firing and protocols and lots of things that you wouldn't necessarily realize you had to think of until you have your own practice. So there's definitely been a lot of that going on, considering I have only recently opened my own practice. I did want to make sure that we covered all of the questions here. The two more questions that have been asked. So first of all, someone asked about the salary for aesthetic nurses. So this is really going to vary, again, based on where you're at, based on your profession, based on whether you're working for yourself, for somebody else. It obviously lots of factors tie in, but there's a really good resource that Nurse.org has that I'm going to link here. So my Instagram takeover is coming to a close. I wanted to thank Nurse.org for this opportunity and for getting to share with all of you kind of the day in the life of an aesthetic NP and some of the behind the scenes stuff. If there's anything we didn't cover, if you have any other questions, please feel free to reach out at any time. You can DM me, and I'm happy to answer any questions you have and provide any support that I possibly can. I also wanted to answer the last question and leave you with a few words of advice in case you're looking to get into aesthetic medicine. So the final question was, what are the processes that you took to learn what you learned to become an aesthetic practitioner? So essentially, you would start with a foundational course that would just teach you the bare minimum basics. You're going to learn about anatomy of the face and neck, as well as physiology of aging and the mechanism of action. My recommendation would be to start with the basics of neuromodulators and get really comfortable doing that, just the upper face. As you get a little more experience, move into the lower face, and then once you get comfortable with a needle and injecting faces, then you would move into some hyaluronic acid fillers, starting with, cheeks, lips, chins, just some basic areas. And then with experience and with time and with further education, you would move into more advanced areas such as tear troughs, jawline sculpting, temples, and then eventually, potentially, into foreheads and noses and higher risk areas, as well as biostimulants, threads, and starting to move on to other procedures. One thing about aesthetic medicine, it is a really fun job. But it also comes with a great responsibility. You have to continually educate yourself. You have to remember that your patients are paying patients and it's elective. So they have a choice. They don't have to do the procedures and you don't have to be their provider. So there is an element of customer service to it. Now, I know in the US, it is privatized healthcare down there. So it is a little bit more customer service focused than we are here in Canada. However, there is that option to it. Now, that said, lots of really great things. I mean, amazing conferences, very supportive community in a lot of ways. Sometimes, depending where you are, there might be a little bit of competition, but overall, I would say this community is quite supportive. There's a lot of groups out there, and if you're having trouble finding any, again, just reach out to me at any time, and I'm happy to help as much as I can. And then last but not least, and I think one thing that is really important as an aesthetic clinician that we all need to remember is that we are here to make patients' lives better in some way or another. And at the end of the day, sometimes that means saying no to patients, even though they're there and they're paying you and they're asking you to do a procedure. It's not necessarily in their best interest, and it's up to you to guide them and to educate them and to make sure that they understand what we do, even though it is a service. It is still healthcare and it is still medicine, and we all need to practice with ethics and with integrity. A big part of this job is relationships, making relationships with your colleagues and making relationships with your patients, long-term relationships, and continuing education is key. This is a fast-growing industry. We're learning lots, so there's always lots to learn. I recommend going to 1 to 3 conferences a year. I usually try to do at least 2 or 3 conferences or educational events a year on top of webinars and reading articles and whatnot. So it's been a pleasure. Thank you all for your wonderful questions. And again, feel free to reach out at any time if you have any questions. Thank you, Nurse.org. This has been fantastic. And I will post this again, but Nurse.org has some really great links if you're interested in getting into aesthetic nursing. Take care, everyone. Bye.